The noblewoman's face burns as she applies a paste made from crushed mercury, white lead, and vinegar, the toxic mixture eating away at her skin while she believes it will grant her the pale complexion that medieval society demanded. Her breath grows shallow from mercury poisoning. Her teeth loosen from lead absorption, and her flesh begins to ulcerate beneath the cosmetic mask that promises eternal youth. Medieval beauty standards were not merely preferences. They were deadly obsessions that drove women and men to poison themselves daily with substances that would horrify modern toxicologists. The pursuit of pale skin, bright eyes, and youthful appearance led medieval people to smear their faces with compounds containing mercury, lead, arsenic, and human waste. These were not crude folk remedies used by desperate peasants, but sophisticated cosmetic formulations prescribed by university-trained physicians and used by the highest nobility across Europe. The beauty treatments documented in medieval manuscripts reveal a systematic campaign of self-poisoning disguised as vanity. Wealthy women applied mercury-based face paints that caused neurological damage, used lead compounds that destroyed their internal organs, and rubbed arsenic preparations into their skin believing it would prevent aging. The most disturbing aspect of these practices was not their toxicity, but their widespread acceptance among the educated elite who understood they were applying poisons to their bodies, yet continued the practice for decades. Medieval beauty ideals centered on achieving the palest possible skin, a standard that drove women to apply increasingly toxic compounds to their faces and bodies. The most prized cosmetic ingredient was mercury, known in medieval texts as quicksilver, which was mixed with white lead and various acids to create face paints that literally ate away at the skin's surface layers. The recipe for ceruse, the most popular medieval face paint, required heating mercury with white lead powder and vinegar until the mixture formed a smooth paste. This compound was then applied daily to the face, neck, and exposed skin areas. Medieval medical texts by physicians like Trotula of Salerno document the preparation and application of these mercury-lead mixtures, recommending them as essential for maintaining aristocratic beauty standards. The immediate effects of mercury-lead face paints were exactly what medieval women desired. The skin became dramatically pale and appeared to glow with an otherworldly luminescence. However, the long-term consequences were catastrophic. Mercury poisoning caused tremors, memory loss, and severe neurological damage, while lead poisoning led to organ failure, infertility, and premature death. Archaeological analysis of medieval noble burials reveals extremely high levels of mercury and lead in skeletal remains, with some individuals showing concentrations hundreds of times above toxic thresholds. Medieval women understood these substances were dangerous. The same compounds were used as medicines and poisons, yet they continued applying them because pale skin was seen as a marker of nobility and virtue. The whiter the skin, the higher the social status, creating a deadly beauty standard that persisted for centuries. But mercury and lead were just the beginning of medieval cosmetic horror. Arsenic, one of history's most notorious poisons, was a common ingredient in medieval beauty treatments designed to create luminous, youthful-looking skin. Medieval physicians prescribed arsenic-based compounds for treating various skin conditions, not understanding that they were prescribing a substance that would gradually destroy their patients' health. The most popular arsenic beauty treatment was orpiment, a bright yellow arsenic sulfide compound that was mixed with various oils and applied to the skin as an anti-aging treatment. Medieval medical texts like the Trotula manuscripts describe orpiment as essential for maintaining youthful appearance, recommending daily application to prevent wrinkles and age spots. Women would also consume small amounts of arsenic orally, believing it would give their skin a translucent quality and bright, clear eyes. The practice of arsenic eating was documented among medieval nobility, with some individuals consuming gradually increasing doses over months or years to build tolerance while maintaining the cosmetic effects. The physiological effects of chronic arsenic poisoning created exactly the appearance medieval people associated with ethereal beauty. Arsenic caused the skin to become pale and translucent, the eyes to appear larger and brighter, and gave the overall complexion a luminous quality. However, this glow was actually the result of severe toxicity that was simultaneously destroying the liver, kidneys, and nervous system. Medieval physicians documented the symptoms of arsenic poisoning but failed to connect them with the cosmetic treatments they prescribed. Patients would develop tremors, hair loss, and severe digestive problems, yet continued using arsenic-based beauty treatments because the cosmetic effects were so highly valued. The widespread use of arsenic in medieval cosmetics created a population of chronically poisoned nobility who were slowly killing themselves in pursuit of beauty standards. Medieval dental hygiene and beauty treatments incorporated human and animal waste as essential ingredients based on medical theories that viewed urine and feces as potent therapeutic substances. The dominant medical theory of the time held that bodily waste contained concentrated essences that could cure diseases and enhance beauty when properly applied. Human urine was considered one of the most valuable cosmetic ingredients, particularly the urine of young, healthy individuals. Medieval beauty recipes called for fresh morning urine to be used as a face wash, believing it would clear the complexion and prevent aging. The practice was so common that wealthy households maintained supplies of urine from carefully selected donors, often young servants chosen for their health and diet. The medical rationale behind urine treatments was based on the theory of like cures like. Since urine was produced by healthy kidneys, it was believed to transfer that health to whatever part of the body it touched. Medieval physicians prescribed urine for treating skin conditions, whitening teeth, and maintaining youthful appearance. The Trotula manuscripts include detailed instructions for preparing urine-based cosmetics, including aging the urine in sealed containers to concentrate its supposed beneficial properties. Animal feces was another common ingredient in medieval beauty treatments, particularly bird and pig excrement. These substances were mixed with various oils and applied to the skin as anti-aging treatments. The theory was that since animals maintained healthy, resilient skin, their waste products would transfer those qualities to human skin. The use of human and animal waste in cosmetics was not limited to folk medicine. It was prescribed by university-trained physicians and used by the highest levels of medieval society. The revolting nature of these treatments was acknowledged, but their supposed benefits were considered worth the disgust they inspired. Medieval beauty treatments incorporated human blood, bone, and other bodily materials as essential ingredients based on the belief that these substances contained vital essences that could restore youth and beauty. The practice of using human remains in cosmetics was widespread among medieval nobility and had the full support of medical authorities. Human blood was considered particularly valuable for cosmetic purposes, especially the blood of young, healthy individuals. Medieval beauty recipes call for fresh human blood to be mixed with various oils and applied to the skin as an anti-aging treatment. The blood was believed to contain the life force of the donor, which would transfer to the recipient and restore their youthful appearance. The most prized blood was believed to come from criminals, whose bodies were thought to retain potent vitality after punishment. Medieval records document the practice of collecting blood from public executions for use in cosmetic preparations. The blood would be mixed with mercury and lead compounds to create face paints that combine the supposed rejuvenating properties of blood with the whitening effects of toxic metals. Powdered human bone was another common ingredient in medieval cosmetics, particularly bones from young individuals or those who had died violent deaths. The bones would be ground into fine powder and mixed with various substances to create face powders and skin treatments. Medieval medical theory held that bones contained concentrated life essence that could be transferred to living tissue through topical application. The use of human remains in cosmetics was not considered morbid or disturbing by medieval standards. It was seen as a practical application of medical knowledge about the body's vital essences. The fact that these substances came from corpses was irrelevant compared to their supposed cosmetic benefits. These corpse-based treatments were expensive and exclusive, available only to the well-to-purchase human remains for cosmetic purposes. Medieval tooth whitening treatments involved applying highly corrosive acids and toxic metals directly to the teeth and gums, causing permanent damage while achieving the desired whitening effect. These treatments were based on the medieval understanding that white teeth were essential for beauty and social acceptance. The most common tooth whitening treatment involved applying nitric acid directly to the teeth using small brushes or cloths. The acid would dissolve the tooth enamel, creating a temporarily white appearance while permanently weakening the teeth. Medieval dental texts describe this process in detail, acknowledging the pain and damage it caused while still recommending it for cosmetic purposes. Mercury was also used extensively in medieval tooth whitening treatments. Dentists would apply mercury compounds directly to the teeth and gums, believing this would create a bright white appearance. The mercury would cause severe gum damage and tooth loss, but the immediate whitening effect was considered worth the long-term consequences. Lead-based tooth powders were another common medieval dental treatment. These powders would be rubbed directly onto the teeth using rough cloths or brushes, removing stains while simultaneously poisoning the user through absorption through the gums. The lead would cause neurological damage and organ failure, but the cosmetic effects were highly valued. Medieval physicians understood that these treatments were dangerous. They used the same substances as medicines and poisons, but continued prescribing them because white teeth were seen as essential for social acceptance. The pain and damage caused by these treatments were considered acceptable prices to pay for the desired appearance. The widespread use of toxic tooth whitening treatments created a population of nobility with severely damaged teeth and chronic poisoning. Yet the practices continued because the cosmetic standards demanded white teeth regardless of the health consequences. Medieval beautification treatments involved applying toxic substances directly to the eyes to create the large, bright pupils that were considered the height of beauty. These treatments caused permanent vision damage and blindness while achieving the desired cosmetic effect. Belladonna, a highly toxic plant also known as deadly nightshade, was a primary ingredient in medieval eye treatments. The plant contains atropine, a powerful alkaloid that causes the pupils to dilate dramatically. Medieval women would apply belladonna extract directly to their eyes, creating the wide-eyed look that was considered extremely attractive. The immediate effects of belladonna were exactly what medieval beauty standards demanded. The pupils would become dramatically enlarged, making the eyes appear larger and more luminous. However, belladonna is extremely toxic and causes severe vision problems, including blurred vision, light sensitivity, and eventual blindness. Medieval medical texts acknowledge these dangers, but continue to recommend belladonna for cosmetic purposes. Mercury was also applied directly to the eyes in medieval beauty treatments. Small amounts of mercury would be placed on the eyelids and around the eye area, believing this would create a bright, luminous appearance. The mercury would cause severe eye irritation and damage, but the cosmetic effects were highly valued. Medieval physicians prescribed various other toxic substances for eye enhancement, including antimony, lead compounds, and various plant extracts. These substances would be applied directly to the eyes using small brushes or cloths, causing immediate pain and long-term damage. The use of toxic eye treatments was widespread among medieval nobility, with archaeological evidence showing high levels of mercury and other toxins in the eye socket areas of medieval skulls. The pursuit of beautiful eyes led to systematic poisoning and blindness among the very people who could afford the most expensive cosmetic treatments. Medieval hair treatments involved applying caustic substances that would burn the scalp and destroy hair follicles while achieving the desired cosmetic effects. These treatments were based on medieval beauty standards that demanded specific hair colors and textures regardless of the health consequences. Lye, a highly caustic substance made from wood ash and water, was a primary ingredient in medieval hair treatments. The lye would be applied directly to the hair and scalp to lighten hair color and create the pale blonde shades that were considered most beautiful. The lye would burn the scalp and destroy hair follicles, but the immediate lightening effect was highly valued. Medieval hair bleaching recipes also included sulfur, mercury, and various acids that would be applied to the hair and scalp. These substances would create the desired color changes while causing severe chemical burns and permanent scalp damage. The pain and injury caused by these treatments were considered acceptable prices to pay for fashionable hair color. Arsenic was commonly used in medieval hair treatments, both applied topically and consumed orally. The arsenic would cause hair to become brittle and fall out, but it also created a distinctive pale color that was considered beautiful. Medieval beauty manuals include detailed instructions for using arsenic in hair treatments, acknowledging the dangers while still recommending the practice. The most extreme medieval hair treatments involved applying concentrated acids directly to the scalp to remove unwanted hair. These treatments would cause severe chemical burns and permanent scarring, but they were considered necessary for achieving the desired hairline and facial appearance. Medieval barbers and physicians understood that these treatments were dangerous, but they continued prescribing them because the cosmetic standards demanded specific hair colors and styles, regardless of the health consequences. Medieval skin treatments involved applying corrosive substances that would literally burn away layers of skin to achieve the smooth, pale complexion that was considered the epitome of beauty. These treatments were based on the medieval understanding that perfect skin required the removal of all natural color and texture. The acid peels were common medieval beauty treatments involving the application of various acids to the face and body to remove the outer layers of skin. The acids would cause severe chemical burns and permanent scarring, but the immediate effect was exactly what medieval beauty standards demanded: pale, smooth skin that appeared almost translucent. Medieval physicians prescribed various corrosive substances for skin treatments, including sulfuric acid, nitric acid, and various plant-based caustics. These substances would be applied to the skin using brushes or cloths, causing immediate pain and long-term damage. The treatments were considered necessary for maintaining aristocratic beauty standards. The most extreme medieval skin treatments involved applying heated metals directly to the skin to remove unwanted pigmentation and scarring. These treatments would cause severe burns and permanent disfigurement, but they were considered acceptable for achieving the desired appearance. Medieval beauty manuals include detailed instructions for preparing and applying corrosive skin treatments, acknowledging the pain and damage they cause while still recommending them for cosmetic purposes. The pursuit of perfect skin led to systematic disfigurement among medieval nobility. The continuation of these horrific beauty treatments, despite their obvious dangers, reveals the extreme social pressure that medieval people faced to conform to beauty standards. The pursuit of pale skin, bright eyes, and perfect features was not merely vanity, it was essential for social acceptance and economic survival. Medieval society viewed physical appearance as a direct reflection of moral character and social status. Pale skin indicated nobility and virtue, while dark or imperfect skin suggested low birth and moral corruption. The pressure to maintain these standards was so intense that people willingly poisoned themselves rather than risk social rejection. The medical establishment supported these practices because they were based on accepted theories about the body and health. Medieval physicians genuinely believed that toxic substances could improve health and appearance when properly applied. The fact that their treatments caused obvious harm was explained away as necessary suffering for achieving greater benefits. The economic incentives surrounding medieval beauty treatments were enormous. The cosmetics industry was extremely profitable, with wealthy individuals spending vast sums on toxic preparations. The physicians, apothecaries, and merchants who supplied these treatments had strong financial motivations to continue the practices regardless of their dangers. Medieval people understood that their beauty treatments were dangerous. They used the same substances as medicines and poisons, but the social consequences of not conforming to beauty standards were considered worse than the health risks. Modern archaeological analysis of medieval skeletal remains provides undeniable evidence of the widespread poisoning caused by medieval beauty treatments. The bones of medieval nobles contain concentrations of mercury, lead, and arsenic that are hundreds of times above toxic levels, proving that these substances were regularly consumed and applied to the body. Analysis of medieval hair samples preserved in burial sites shows extremely high levels of toxic metals, indicating that hair treatments containing mercury, lead, and arsenic were common. The hair damage visible in these samples corresponds exactly to the effects described in medieval beauty manuals. Examination of medieval skulls reveals characteristic damage patterns consistent with the application of corrosive substances to the face and scalp. The bone erosion and scarring visible in these remains matches the effects that would be expected from regular use of acid-based cosmetics. The dental remains of medieval nobles show severe damage consistent with the use of acid-based tooth whitening treatments. The enamel loss and bone damage visible in these teeth corresponds to the effects of applying nitric acid and other corrosives directly to the teeth and gums. Isotope analysis of medieval bone samples has revealed the geographic origins of the toxic substances used in beauty treatments, showing that these materials were traded across vast distances to supply the cosmetics industry. The scale of this trade indicates how widespread and profitable the medieval beauty industry had become. The archaeological evidence provides irrefutable proof that medieval beauty treatments were systematically poisoning the very people who could afford the most expensive cosmetic preparations. Medieval physicians played a crucial role in legitimizing and perpetuating the use of toxic beauty treatments, lending their medical authority to practices that were slowly killing their patients. University-trained doctors prescribed mercury, lead, and arsenic as cosmetic treatments while simultaneously understanding their toxic properties. The medical texts produced by medieval physicians contain detailed recipes for preparing toxic cosmetics alongside warnings about the dangers of the same substances when used as poisons. This contradiction reveals how medieval medical thinking could compartmentalize the toxic effects of substances when they were used for cosmetic purposes. Prominent medieval physicians like Trotula of Salerno wrote extensively about beauty treatments, providing detailed instructions for preparing and applying toxic cosmetics. These texts were widely copied and distributed, spreading dangerous practices across Europe under the authority of respected medical institutions. The university medical schools that trained medieval physicians taught courses on cosmetic preparation alongside traditional medicine, treating beauty treatments as a legitimate branch of medical practice. This institutional support gave toxic cosmetics the imprimatur of scientific authority. Medieval physicians understood the symptoms of mercury, lead, and arsenic poisoning. They used these substances as medicines and documented their effects extensively, yet they continued prescribing the same substances for cosmetic purposes, suggesting that the social pressure to conform to beauty standards overrode medical concerns about patient safety. The complicity of the medical establishment in promoting toxic beauty treatments reveals how professional authority can be used to legitimize harmful practices when they serve powerful social and economic interests. Medieval beauty treatments created a cycle of dependency that trapped users in increasingly dangerous practices. The toxic substances used in these treatments caused damage that required additional treatments to conceal, leading to escalating levels of poisoning over time. Mercury and lead face paints would damage the skin, creating discoloration and scarring that required heavier applications of the same toxic substances to cover. This led to progressively worse poisoning as users applied larger amounts of mercury and led to maintain their appearance. The neurological damage caused by mercury poisoning would create tremors and coordination problems that were seen as signs of refinement and delicacy among medieval nobility. This led to the deliberate cultivation of mercury poisoning symptoms as desirable beauty traits. The tooth damage caused by acid whitening treatments would require increasingly aggressive procedures to maintain white teeth. Users would progress from mild acid treatments to more concentrated solutions, eventually destroying their teeth entirely while continuing to pursue the beauty standard. The eye damage caused by belladonna treatments would create vision problems that required stronger doses to achieve the desired pupil dilation. This led to progressive blindness among users who were unwilling to abandon the beauty standard. Medieval people became trapped in cycles of toxic beauty treatments that were simultaneously destroying their health and creating the appearance they desperately sought to maintain. The addiction to these treatments was both physical and psychological, driven by social pressures that made the health consequences seem acceptable. The legacy of medieval beauty treatment stands as a testament to humanity's capacity for self-destruction in pursuit of social acceptance. The archaeological evidence preserved in medieval bones reveals the true cost of beauty standards that demanded a systematic poisoning of those who could afford to pursue them. These skeletal remains laden with mercury, lead, and arsenic serve as permanent monuments to the suffering endured by people who trusted medical authority to guide their pursuit of beauty, only to be led into a slow death disguised as cosmetic enhancement. The holes eaten by acid, the bones weakened by poison, and the teeth destroyed by corrosive treatments all bear witness to the horrific price paid for medieval beauty standards that valued appearance over life itself.